Today we want to talk about some of the PPE we have in our stations to be able to respond to potential flu cases and also the COVID-19 virus. This is some preliminary videos just to make sure that we're all on the same page as we start to get the equipment out and into the stations and make sure everybody's donning it and doffing it appropriately. Now there'll probably be some follow-ups to that. This is, like I said, just-in-time video, just-in-time training. We're trying to get this out to everybody. So bear with us and we'll give you updates as we need to do it. First item we're going to look at is gloves. We're going to make sure that we have at least 2 pairs of gloves with us. These are, again, supposed to be put in a Ziploc bag or a personal protection kit that you can make based on our sizing. And our recommendation is that you have 2 gloves with you. One standard size glove, and you may want to go up in size for the other glove just to accommodate dexterity and the things you'll need to do while wearing them. The N95 mask, everybody should have one of these available to them. We do have some on the apparatus. I would also place one in your personal kit, have it with you at all times. As we go through the current events, things may change on a regular basis, and we need to understand that we may not have enough of these to go around, so we want to make sure that we use them somewhat sparingly. And again, I don't want to preclude anybody from using these if you absolutely think you need to need them, or we have patients that meet the criteria of being infectious or potentially having COVID-19. So don't hesitate to use them, but understand in the background that these are going to be fairly limited to get in the future. I heard some information it could be up to 3 weeks to be able to get these. We do have some on order, and the question is we don't know where they're at, but they are on order, and we'll do the best we can with what we have. Goggles. Goggles provide higher level of protection than the safety glasses that were initially issued. You're welcome to keep those for other types of activities the department does. I would encourage you just to keep them with you. Extrications, other activities that we engage in where we have potential for eye injury, make sure you keep them with you. But these are what we want to start using on patients that we believe are potentially infectious, have been in, or could potentially have the flu virus or the COVID-19 virus. These are liquid tight. They do have vents on them, so they shouldn't fog up. They're going to be a little bit uncomfortable, but I think for the limited amount of time we're going to have on, I want to make sure that this is the level of protection that we're wearing. Again, aerosolized droplets in the eyes. Eyes are a tremendous opening to allow for those types of things to enter into the body and create an infection. One other point I want to make about the N95 mask, you need to form fit these. Everybody's been fit tested before on a different type of mask. These are very similar to the same rating. Just understand that there is a nose piece that has to be fit to make sure that we're sealing off what we can. The other part of our ensemble here is going to consist of these boot covers. These are kind of new. Anybody's made packs earlier in the last week and a half. These were not part of that. Doing some further research and finding that these were available, we find that these are going to probably be pretty good for at least the bottom of our boots, our street clothes, our uniform boots, and for most of the tops of them to prevent any type of, viral-laden aerosolized particles that are coming out of a patient. So these will protect their feet. If you know anything about leather, it's very difficult to decon, and those are the things we want to try to avoid. We want to decon. We want to use our equipment as a barrier. Again, the biggest thing with all of these viruses is time, distance, and shielding. So when we talk about time, distance, and shielding, we want to think about let's minimize the time we're in there being potentially exposed. Let's minimize the distance or maximize the distance between the patient and what we're trying to do. And even assessments, we have to give some pretty good consideration to how far we're going to assess a patient based on the level of risk and the exposure that we could have. Time, distance, shielding. PPE is the shielding part of this, and we want to make sure that before we enter these environments or suspect environments, you get dispatch information that suggests you could have a patient that is positive for any of these viruses. We want to make sure that we don this prior to entering, I would say, the front door or the back door, however you're getting into the structure. We want to make sure that that's available. So we've got our gloves, N95 mask, goggles, boot covers, and the last part of this ensemble is actually the Tyvek suit. Per the Region 6 Healthcare Coalition, this provides adequate protection for separating us or shielding us from the bacteria, not the bacteria, but the viruses that create or cause the common flu and also the COVID-19 virus. 2 ways to wear this suit. And again, I want to talk a little bit about why we elected to use a coat or a lab coat style. Most healthcare or clinical healthcare professionals are utilizing a gown. Those tend to be long, and again, there is a portion of our pants that may be standing out, but if we minimize our distance and cover the upper part of our bodies, we have good eye protection, our mask and our shoes, we should be in good shape. Some of the factors that played into this were accessibility, the ability to get various sizes, and also to provide for that variation of fit. If you wear a large coat, Yeah, in one call, it's not going to hurt you if it's too big. Suits are very cumbersome, and you can always find we may end up tripping and falling. So time was also a consideration. We wanted to make sure when we put those suits on that we could get them on quickly so we could get our interventions going and so on. This suit can be worn two ways, or this jacket or coat. We'd like to see people probably try to attempt to wear them backwards. And the reason we want to do that is, one, this is the only PPE that we have that's available for us right now other than suits. And we have a large seam in the front, or opening, that we want to try to protect. So if we can place that in the back, that's going to minimize our potential for exposure and potential aerosolized particles getting into the suit. So the idea is if you can tolerate it wearing it backwards, it's going to require us to use the buddy system, which we should be doing anyway before we enter a space. That's what we want to do. So we'll try to put it on backwards. If you are going to wear it front ways, we will have duct tape available. I would recommend you snap it up and place some duct tape to seal the front up. That's an extra step. I think if you can get by wearing the suit backwards, that's probably going to be the best way to approach it. Some of the protocols we're looking at are going to look at how we address some of our patients. You may only find that one responder is actually suiting up and going into the space unless it's needed. There'll be more to come on that. And just to make sure that everybody's on the same page, everybody on the scene should at least have this stuff available to them, and then decide who's wearing what and go in. Buddy system, getting dressed out, making sure we cover what we can, double set of gloves. And the last part of this we do want to talk about is once you've doffed your material or your PPE and you are preparing to clear the corridors, we want to make sure that you decon appropriately and you doff this PPE. So we're going to go through a process here when we get somebody, we're going to actually dress somebody out. We'll go through the donning and doffing. We do have a bag in the kits, the Ziploc bags we talked about earlier. This will be where you'll put all your materials. The goal with this is to leave this on scene or provide it to the ambulance, put it in the ambulance where the patient is going to dispose of it in their waste. We do not want this back in the station. We do not want people having PPE on, getting into the apparatus to come back. This all has to happen outside, preferably maybe on a front porch or out of the area, out of the view of the public, and certainly away from our apparatus. Any bags, anything like that, we're going to have to make sure that those are decon. Again, per the directive that went out, we want to make sure that staff or firefighters or personnel aren't bringing their bags or any other equipment they need into that environment unless they absolutely need it. Again, we would probably look at trying to assess patients in another location, minimize our exposure. There'll be more on this as far as protocols go from the state of Michigan. As we get out, we're going to basically doff the equipment into this bag. We'll leave it on site. Once that's done, I think it's preferable to get that in an AMR ambulance or a life ambulance for transport for disposal by them. If we do need to, if we can't do that, the ambulance is left, we want to leave it on scene, and then mount up on our apparatus and get back here and clear the corridors. Any suspected exposure based on what you're seeing, signs and symptoms, we want to make sure that we do a good, thorough decon back at the station. We're going to designate an area in each station where that can happen. Right now it's probably going to be the mechanics room at the Collin Park station and possibly the rear storage room over at the Waverly station, where we can just get in there, undress, get out of our uniform, get changed into a clean uniform, rather make it to a shower and then change into a clean uniform, and then we'll go from there. But for now, making sure that we do not bring anything back, making sure we're cleaning up before we enter the living quarters and do the best we can there. So decon is going to be really important of any engine, any piece of equipment that goes out on these calls. We're going to recommend wiping off the steering wheels, wiping off any flat surfaces that you may have come in contact with while responding. There is a concern about what we're thinking with our upholstered seats. We're looking at some makeshift aids to maybe protect those seats in the event of an exposure. One of the other things we do want to talk about is what's the difference between exposure and what is just simply being in an environment wearing PPE. An exposure, by definition, is we actually have the infectious substance on us or in a route of entry. Intact skin may not help us on this because we're going to have particles on our face, and if we rub our face, we're going to get into that or get that into our mucous membranes and potentially become infected. So we want to make sure that we document any type of exposure like that. We have a patient that is coughing and you get particulate on your face, it's on your goggles. We want to come back and follow our procedures to make sure that we get that done. So with that said, we're going to step out and we'll bring somebody in, we'll try and dress somebody up and get them going. All right, we're gonna do a little donning and doffing just to show you some best practices as far as how to get going. You can vary this up how you want, but the idea is, there should be a process that you practice and you're familiar with every time. This is a suggestion, comes from some of the hazmat world work that we do, and we'll just kind of play off that. The last thing we're gonna do is gonna put the mask on and the goggles. So we're gonna start from this table and just kind of move over that way. Understand when you put a suit on or you wear any type of garment like that, it limits your flexibility and your mobility. So that's why we're going to recommend you put your boot covers on first. So let's start out. I got Karen here helping us today. Thanks, Karen. And we're going to start with a pair of, at least one or two pair. Our recommendation is that you use two pairs of nitrile gloves. And as I said in the previous portion of this, we want to make sure that we try to enhance our dexterity by putting on the right size glove. Wear your standard size glove. If you need a bigger glove out, go ahead and do that. That'll provide a little more dexterity. You can see here we got plenty of room in these gloves right here. Next thing we want to do is we're going to slip on our boot covers. Sometimes if you can lean up to next to something, you can put your foot in there and pull it over the heel. Again, these are boot covers. They're outer covers. All they're doing is just trying to protect us from any particulate or aerosolized particles that might be on the floor of a residence or building. Remember, we're not contaminated yet, so we can touch, we can move. We don't want anybody to fall. We don't want to, just make sure you're comfortable with everything you got going. As we said, there's two ways of putting this on. I recommend the buddy system. You're checking everybody out. Make sure you're on. We're suggesting that we put these on backwards. I know a lot of people might think that's funny, but keep in mind, the way this suit is set up, there's a big gap in the front, and that's a space that would allow particulate or aerosolized virus to end up in the suit itself. So I'm not going to button everything up here, but you guys will get the idea. It's going to require that you help each other to do that, especially this way. The alternative, and I'm not going to do it because it generally ruins the suit, is to have the opening in the front and then simply place a piece of chem tape or duct tape on the front of it. In the department today, given the cost of, we're not going into a chemical environment, chem tape's probably more of an expense than we need, and it's probably in short supply. So we're just going to use standard duct tape if you'd like to do that. Make sure the collar's up. That does provide a little more protection around the eye. So hospital workers are generally going to look like that. That's probably what they're going to have. Again, we have that small space by our feet. Again, we need to look at risk potential, how far away from the patient. If we're too close, the patient's probably going to cough and hit us here, not necessarily on our feet. But some of the research they're suggesting right now is up to 3 hours these particles can sit in the air. Okay, next we're going to go ahead and we're going to put our mask on. Thing to remember about an N95 mask, put them, we're going to want to put both over our ears, and then we'll adjust.
I don't know if it's going to fit.
It will.
Oh, yeah.
Okay, so, right, very good. What Karen's doing is moving the bottom strap down here towards the bottom of the neck. Buddy can help. And one over the ears. You're going to find it's going to get real uncomfortable if you get that too low and it's sitting on the ear. Again, we're not wearing this stuff that often, but we want to make sure. What's the other key factor we want to do is make sure that mask is fitted. So we're going to want to press fit that around the nose and eliminate any air incursion that's going to come past either the nose piece or around the sides. Great fit. Again, if we can increase the distance, we're minimizing the potential for exposure. But if we have a good fit around the mask, that's also going to help us as well. So the last part of this, we're going to place our goggles. And that's our ensemble right here. Added protection, again, if there's tons of fluid, there's lots of fluid, the best bet may be to pull the biohazard exposure kit out of the engine. A lot of those are back in the med bags, and it'd be quicker to have this available right with you with your Ziploc bag. But right now, that's what we're using as far as our ensemble goes. I want to make sure that everybody kind of dresses out this way. Again, you can wear the jacket front, you can wear it back, but I highly recommend that we try to seal up the front seam so that we don't get that the aerosolized virus in the back. So pretty comfortable. Yep. These have non-slip on the bottom of them, and they are they're not permeable to liquid. So that's that. So how do we doff this gear? We'll walk through a quick process on how to do that. We're going to do everything the opposite. Probably having a partner assist. Keep in mind you might have your partner with you. They're going to be in PPE as well. It may be helpful for them to actually help hold the bag open for you. But every kit should have a plastic bag very similar to this. And you know, in the hazmat world, we used to do some things where we'd actually dress down in the bag, but I think we want to avoid having to get in contact with that suit once we get it off. So we'll open the bag up gently. It won't hurt our sound. And I would just simply lay it on the ground next to you. They are big enough, and you'll have room to do that. So the first thing that comes off is what?
Goggles?
We're going to want to take, those will be the last things we're going to take off.
Okay.
So we're going to want to remove our outer garment or our smock. And again, you probably want a buddy to do that because you never want to touch the inside of the suit. Buddy on the outside assisting you is going to only touch the outside of the suit, okay? They have a potential of having it on their hands. We want to make sure that they are only touching the outside of the suit. So we'll do that, and they'll try to help you fold that suit over. Just turn it inside out like you normally would with a pair of gloves. You're going to take the suit, you're going to put it into the bag. I would go ahead and take your outer boot covers off, put those in the bag. Okay. I would gather the bag. You know, keep in mind, we have particulate here. We want to be very careful on how we do this. So we're going to try and get most of our materials and get that bag ready to be just about set and ready to go. We're going to take our outer pair of gloves off. The problem is a lot of times those are going to want to come off with your interior gloves. Okay. Just, right. Position the bag so you can do it without having to touch the inside of the bag. Okay. You're starting to touch your face now. You know that you've been handling the patient or potentially taking vital signs or doing an assessment. That outer pair of gloves is gone now. It's in there. These gloves should be clean as long as there's not a hole in them or anything like that. Keep in mind, you could have aerosolized particles around your face, but realize you're not going to bring them to your face if you got a clean pair of gloves on. That's why we want you to put 2 pairs of gloves on. Work from the dirty to the clean. Again, we can avoid a lot of this by good distance from our patients. So the next thing we'll take off are our goggles. Throw the goggles away. They're $1.50. Believe it or not, those are $1.50 a piece. They're not worth deconning. So we're going to put them right in the bag. Okay, Karen will go ahead and remove her mask. Throw that in the bag. Last thing that comes off, and we turn them inside out, one inside the other, will be the gloves. Now everybody's going to say, okay, we've got this bag full of potentially infectious material. How do we handle this now? Again, I would probably go get another pair of gloves, or using the gloves you have, you could probably gather that up, tie it up. Again, we don't want to squeeze the air out of the bag. So anytime you touch this bag, make sure you have another pair of gloves. A lot of us carry them on our hip. Just make sure you know those gloves had potentially infectious material on them. They're in the bag right now. You touched your mask, you touched your goggles, put those gloves in there, be done with it. Get a fresh pair of gloves before you start handling the bag. We'll take the bag without trying to squeeze the air out of it. And we're going to place that where? We're going to place that probably with AMR in their rig for disposal, although we want to try and limit the viral load that might be in there. So it's probably best, and we're going to recommend that you simply leave it on site. We can always figure out a way to get it later. And depending on the number of patients we have that are potentially infectious or legitimately infectious, that is something we can deal with later. Again, we just don't want to bring that back to the station. Next steps are we're going to go wash our hands. We have hand sanitizer in the trucks. We're going to make sure we get those cleaned up. Again, that's just the first step. We're going to make sure that if we had anything on our clothing, we may have to have a plan B to figure out how to avoid contact with the apparatus. Any bags that we have there, we want to make sure that we clean them up. If you can't clean them up or they're grossly contaminated, do not put them in the cab. Do not put them in the compartments in the cab. Let's find an exterior compartment and try to get them cleaned up later once we get back to the station. Again, trying to figure out some areas where we can do decon in the station. We're going to have to designate some of those areas, and that'll be something to come. You'll see that in a directive from our office. Thank you, Karen.
Welcome.